Assalamu alaikum. My name is Mohammed and I recently passed the ADC examinations. To get started, when I wanted to take my ADC Part 2 exam, I was actually very lost. I didn't know what to do, I didn't know where to start, and that was, or it still is, one of the biggest issues that candidates of the examination Part 2, experience. I always thought to myself, why is there no video that could just help me just know the proper steps on how to get prepared? And so this is the reason for this video. Of course, I want to start off by all thanks is to Allah, in which by His grace I passed the exam. In any task in life, there are always two components. There's the part that's on you, and then there's depending on Allah to make it happen. So what I'm going to do is I'm going to show you what is on your part, what you have to do to make sure you are ready for the exam. And then the rest is on Allah. If it happens, then it's for the best. If it doesn't happen, then it's also for the best, but the reason isn't clear right now. Now, to begin with, I do advise all candidates to take a look and read very well the practical examination handbook that is present on the Australian Dental Council examinations homepage. This will help you a lot, and basically most of my information is actually from that handbook, but just putting it in more simple terms and more understandable terms. So the exam is actually covered over 2 days, where you have one of the days it's going to be based on working, the technical task day, and the other day is going to be based on clinical skills day. That's what they call it. It's like OSCEs and so on. So basically on the first, or let's say on one of the days where you have the technical tasks, you have 3 tasks that are restorative based, 3 tasks that are preparation based. So when we're talking about the preparation-based tasks, we're going to be doing, one of them is an endo-access cavity. The second would be a caries removal, and there are actual specific teeth that have dentine, enamel, and caries. And these are the teeth that you're going to be working on, that we call them caries-stimulated teeth. And the third, let's say, preparation task is the crown prep for a tooth. Now for the restorative tasks, the first one would be the actual making the temporary crown prep that you did. The second would be a complex amalgam restoration, and the third one would be a composite restoration. Now, of course, they don't have to be done in the order that I just said. You can do whatever order you want. During that day, you have a certain amount of time, you have 6 hours to do everything that they present to you in the tasks, and you have a break between them that you are forced to take. And of course, during your preparations, if you feel like you want to take a break with permission, you can. The second, or let's say the other day, is the clinical skills day. So basically it's going to be an OSCE where you're talking to a simulated patient, and there's an examiner in the room, and they will be testing the way you speak, make sure that you're saying everything correct, you're diagnosing properly, you're giving a proper treatment plan, and so on and so forth. There is also a part of that day where you'll be doing stuff with your hand. I'll give you examples from the actual handbook. So you might be taking an intraoral radiograph, you may be designing a partial denture, you may be placing a rubber dam, or you may be managing a medical emergency in a simulated environment. So you just have to put this all in your mind, that the other day there is a part where you'll be talking, and there will be a part where you will be actually doing also some technical skills, let's say, but very minor ones. Like I said, just taking an intraoral radiograph or placing a rubber dam and so on and so forth. So this is basically the exam over, or let's say how the exam will be for the 2 days. Now there are much more details that are present in the handbook, and I still do advise all of you to read the handbook. What I'm telling you is just a summary. Now to go into a little bit more details on the examination, let us talk first about the technical task examination. So, for example, you will be having, as I said, the 6 technical tasks. They will be on different teeth every time. For example, let's just look at one of the technical tasks, and we're going to just look at the resin composite restoration. And so as you can see on the left, you have the observations, or let's say the criteria they are testing you upon, and then how well you let's say do that criteria. They will give you a very good, a satisfactory, a borderline, and unsatisfactory. So for an example, just start with the first one, so polish. So for a resin composite restoration, you have to put in your mind that you want to highly polish it after you've done the whole composite restoration. So that would be very good. If you just some minor polishing is still required, they'll put you in the satisfactory. There is generalized roughness over your composite restoration, then you're in the borderline area. And you'll be in the unsatisfactory area if there is excessive roughness that cannot be polished without compromising anatomy. So when you work for the exam, when you practice at home, or you practice anywhere, you want to make sure you're in the very good and satisfactory area, because that is how you want to pass the exam. Okay? That's just one of the examples. Of course, there are more examples. The restoration integrity is actually straightforward. If the restoration is present and intact, it's very good. If it's not, or restoration is fractured, loose, or missing, it's unsatisfactory. And this is all present in the handbook, all the criteria for each one of these tasks. It's quite straightforward on what to do. Now, how does one prepare himself? Now, honestly, even if you are a very well practicing dentist, there must be time where you practice on plain ivory teeth, or let's say the plastic teeth models. Why? Because these teeth are actually different to normal human teeth. Their texture, the material, the way they are present in the jaw, they are different. So even though you may be very experienced on working on human teeth, when it comes to the plastic teeth, you may not be that successful. So there must be a time where you practice on how to deal with plain ivory teeth. Now, so how can you practice on plain ivory teeth? Well, firstly, you need to buy the dental jaws and the teeth that come with them, the plastic teeth that arrive with the dental jaws. So to begin with, I do want to avoid promoting any shops, any companies, any doctors, any OSCE courses, for example. I don't want to promote anything. However, at the same time, I am telling you of the experience on which I did. So therefore, I may be referring to what I did. This is not necessarily promoting or advertising. This is just telling you the steps I took that worked for me. Not necessarily the best steps, not necessarily will work for you, but this is what I did, and this is what really helped me. So when we're talking about the dental products that I obtained, so the website, or let's say the shop I found in Sydney, which was most convenient because it was close by, was One Dental. Okay, I will place the link in the feed below. And basically, One Dental has everything I needed for the examination, and I bought what I needed and I practiced with it. Now, secondly, you have to know that there are specific type of teeth. So you have the normal plain ivory teeth on which you'll be practicing, let's say, the preparation on. So you have the caries simulated teeth. These are the ones you'll be, practicing to remove caries. You have the endodontic teeth where you'll be practicing endodontic access cavities, and so on and so forth. The secondly is you need a place to practice. Now, some people have set up a home setup. Some people they go to actual centers where they practice. Now, what I did, in my opinion, was probably very simple and very straightforward, was in the dental clinic that I used to practice in Jordan, I sticky taped, basically, my jaws to the dental chair. And I didn't need to put any cheeks, for example, or lips. It's not that important. The idea is that you want to practice indirect vision or direct vision on the module or the teeth module placed in a way that it would be in a mannequin head or in the examination. And that's what I did. And everything was present at the dental clinic, so you got the hand pieces and all that. So just after work, for example, that's what I did. After work, I would practice on the dental chair after I've sticky taped my my dental jaw to the dental chair. And that's it. That's basically what I did to practice. And I don't need no air compressor. I didn't need to buy any of this stuff because I just used the same equipment that was present for me inside the clinic. So that's kind of a quick and straightforward way. Of course, you can do a home setup. Honestly, I did not. And I'm not sure how it is. If you want to take an opinion on how home setups are, you can ask other people. A lot of people have done it, and a lot of people do benefit from it. And you'll be, with your setup, regardless of in the home or in the clinic, practicing daily. Not necessarily daily. You'll be practicing a few times a week for a few hours every time doing a certain task where you'll be focusing on your weakness. And then after you do your task, you'll open your handbook and you'll see where you went right, where you went wrong. Because, for example, in the preparation tasks for the PFM, so there is a part where there is measurements. So the finish line has to be a certain thickness or width. So the buccal reduction, for example, it's about you to be in the satisfactory range. It has to be from 1 to 1.8 millimeters. For the lingual reduction, it has to be from 1 to 1.5 millimeters. This is the satisfactory area. And so you will be measuring with a perio probe, for example, or with an index that you previously made for the teeth on how well you're doing and assessing yourself. So another thing that also helped me with my preparation tasks in the technical day was probably the videos uploaded on YouTube. So we have Dr. Mohamed Solomon. He has uploaded a few videos on, let's say, caries removal, on endodontic tasks, on crown preparation, on composite filling. And so these actually gave me the basic guidelines or the idea on how I should be doing my tasks. And it's upon these that I built myself. I also looked at complex amalgam fillings on YouTube, and I also looked at temporary crown preparation also on YouTube. So these videos, they help me, and they would help a lot of you guys in knowing exactly the steps that are needed for the preparation tasks. If you want, I can give you the link below. Now, after a while where you've practiced all your tasks and you feel like you're doing everything correct, I recommend that one takes a course, a technical course with one of the many present in Australia. Now, like I said, I'm not trying to promote anyone, but this is what I did. So I actually took a course with Dr. Lina Jude and Dr. James at E-DENTA. So it was present in Sydney, it was available to me, the pricing was good, that's why I chose it. There are other places that offer the same guidance. For example, in Western Australia, you have the Perio Training Service. In Melbourne, you have Adam Bedo or DNA Training Center. There's so many, and that's why I'm not trying to promote one specifically. I'm just trying to tell you that it's very preferable that you take a course with a experienced mentor. And when I went to E-DENTA, I got what I needed. Basically, the importance of this is because one thinks he's doing everything correct. So I thought I was doing everything right and I'm going to pass the exam 100%. But when I went to E-DENTA, I found out that I'm doing a lot of mistakes. And I thought I was doing it right, but it was wrong. And that's why you need an experienced person to look at your work until you know, even though you think you're doing it right, but it's actually wrong. You're missing a lot of points. You're doing this wrong. You're doing that right, but you have to do this and that. So I took a 6-day crash course. It was very beneficial for me, and it upped my confidence in my technical preparation tasks. So I felt like, okay, so that's what I should do, and so on. And in this, let's say, time where you take the technical task course, let's say, there's also time to practice. So this is very important, and I consider this one of the most important parts. So for technical tasks, if you want to do very well in, you have to be practicing before, about a month time of practice, either, like I said, home setup or at a dental clinic, or you go to a place where they provide mannequins that you can practice on, and then taking a course depending on how strong you feel in your technical task preparations. Let's say how strong you feel depends on how much you need time. So I felt it was adequate, but I just needed some tips. I went for a 6-day crash course. If you feel like no, you need more, let's say, detailed coverage over what you have to do, you can go for the 2-week and 3-week courses provided by the many let's say, providers in Australia. So that's basically a breakdown on the technical tasks and how to get yourself prepared. Now you have to know that in the examination they will provide you with the instruments. You are not allowed to bring any of your instruments. And so you have to put that in your mind, because the instruments they provide you is actually present in another, let's say, PDF file. I will present that, also found on the Australian Dental Council examinations homepage. So you have to know that you have to practice within the instruments that they're going to provide you. There's no benefit on practicing on instruments that will not be provided for you during the exam. So you have to put that in mind. And that's, for now, basically just an idea about the technical tasks. Now, I may be doing more videos for more detailed information, but for now we can just stop at that for the technical. Now, for the clinical skills day, as I said, the clinical skills day has or covers two different types of skills. So you have the skills where you'll be talking to a patient. It will be actually a simulated examiner or a simulated patient, and there will be an examiner in the room. So altogether you'll be 3 people in the room, and you'll only be talking to the patient or the simulated patient. And of course, like there is in the technical tasks, observations or criteria and what you can do in them, like very good, satisfactory, borderline, unsatisfactory. The same thing is in the communication. So there will be a criteria also present in the handbook, and you will then be assessed according to how well you do this. So for example, when we're referring to builds a relationship, so it would be actually quite satisfactory if you use a calm and friendly tone with neutral body language. Okay. However, if you become aggressive or very loud or inaudible speech or inappropriate body language and so on, see, this will be in the unsatisfactory. So the same way that they mark you on the technical tasks, they're going to mark you on the communication task, let's say, or the task where you'll be talking to the simulated patient. Now, how to prepare yourself for the ADC OSCE communication task. Now, you need to have some theoretical knowledge, and so a guideline presented by Dr. Mohamed Solomon on his Facebook page is as follows. So he states that is to go through therapeutic guidelines, to study clinical problem solving for dentistry, to study OSCEs by Kathleen. And it's a very good book because it organizes the way you present your information to the simulated patient or the simulated examiner. And finally, the DHSV guidelines, the most updated guidelines for specific subjects that are important or may be important for the OSCE communication tasks. Now, these are all present on Dr. Mohamed Solomon's Facebook page group. Now, after doing that, it's important you assess your OSCE skills. So what I did was I took a full course with Dr. Raza Abbas. He has an online course in which he gives me communication tasks. He assesses my way that I communicate with him. He tells me where I went wrong, where I went right, and this was actually very beneficial for me. That with the notes he provided me with. Now, you don't necessarily need to take this course so you can pass the exam. It's what I took, and it's what made me feel very confident and very, relaxed when I did the OSCE communication task. Now, if you have a budget and it's difficult for you to pay for an OSCE communication course, the least you could do is at least take an OSCE assessment. So what I know is that E-DENTA actually does also provide this, in which you go for an hour and they will assess your OSCE communication skills. They will tell you where you went right, where you went wrong, for a much cheaper price. I didn't try it personally, but I've heard of others that have and benefited from it. So with all of that, you should be able to feel confident and ready to go into your OSCE communication task. Now, on the second day, other than the OSCE communication examination you'll also have a clinical skill examination, which is comprised of either rubber dam or taking an intraoral radiograph or medical emergencies, and there are many others that you could be tested with. And the best way I found myself preparing for it was when I took my course with E-DENTA. I practiced for an hour on a mannequin, on how to place a rubber dam, on how to take a radiograph, and I had myself also assessed to make sure I was doing it correctly. So that's what I felt mostly will benefit anyone that wants to improve his clinical skills. It would be to actually practice it under a mentor in any course he decides to take. So this is basically the examination. It's actually not that complicated when it comes to the information they provided, because it's actually quite well explained on what the examination is going to have in it. Now, I will be later on posting a video on how I break down any communication task, but for the time being, I just wanted to put this video out there just so I can get everybody, or give everybody an idea of the exam, and just to make sure that no one feels lost. And Assalamu alaikum wa rahmatullahi wa barakatuh.